Alright, let's go over some differential diagnosis between the endometrial cancer and ovarian cancer. For endometrial cancer, the patient shows the symptoms in the early stage, and we're gonna using the acronym that I marked on the right to differentiate the different subtypes of the endometrial cancer. So the image on the right hand side is going to help explain each categories and classification. As you can see, it has the stretcher versus non-stretcher causes of the abdominal vaginal bleeding. And in addition to this, we also need to differentiate the different types of the cancer by using the histopathological examination to show the markers of the invasion in endometrial cancer, or using the hydrosonography or hysteroscopy to confirm the presence of the polyp. For ovarian cancer, unlike the endometrial cancer that has the clearly early symptoms, but the advantage stage of the cancer can also having the similar symptoms with the other types of the cancer, such as colon cancer or even the endometrial cancer. The patient will complain abdominal pain. So it's important to make the clinical diagnosis on the right cancer. On the other hand, there are some other epithelial subtypes of the ovarian, which we can use the histological subtypes to examine the tumor appearance and the growth under a microscope. And each subtype comes from the different cell origins and has its own molecular changes and markers to help in diagnosis, such as high or low grade serous carcinoma. So we will explain more diagnosis method in the future slides.